This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, a senior attending here.
And I'm Dr. Alara. Today, we're looking at a fascinating new study from the British Journal of Hospital Medicine, published in 2026, titled Brachial Plexus Birth Injury, Current Concepts in its Assessment and Management.
This is a topic that sits at a very complex intersection of obstetrics, neurology, and neurosurgery. Even though we've been documenting these injuries for a long time, the management remains highly nuanced. As the paper points out right at the start, brachial plexus birth injury, or BPBI, is an uncommon but serious complication. Ilara, what stood out to you regarding the natural history of the condition?
The sheer variability is the most striking part. The paper describes a spectrum where some infants experience only mild, transient impairment, while others face significant lifelong disability. Because the course is so unpredictable, the paper emphasizes that these infants require careful and regular monitoring. It's that longitudinal assessment that ultimately guides our decision-making.
Exactly. We can't just look at an infant on day one and definitively predict the 5-year outcome. The assessment phase is active. While we monitor them, we are also implementing conservative management strategies. What were the specific goals mentioned in the text for that early phase?
The primary aims of conservative management are twofold: ensuring a full range of motion and preventing muscle imbalances. It's about maintaining the canvas, so to speak, so that if the nerves do recover, or if we have to intervene surgically, the musculoskeletal system is actually capable of functioning.
Right. If the joint is contracted or the muscles have severely atrophied due to imbalance, the best nerve surgery in the world won't restore meaningful function. But let's talk about that surgical side, the part of the paper our residents will be most interested in. When conservative measures aren't enough, what does the current surgical management look like?
According to the article, surgical management predominantly involves microsurgical nerve grafting and nerve transfers. It's interesting how the paper frames the timeline, because it notes that these neurosurgical interventions may be followed later by further orthopedic procedures, depending on the specific needs of the patient as they grow.
It's a staged approach. We address the primary neural injury first to get as much reinnervation as possible, but we keep the orthopedic options in our back pocket for salvage or optimization later. Now, despite this being a well-known clinical entity, the paper mentions a significant hurdle in how we currently practice.
Yes, the authors highlight that there continue to be broad variations between the management pathways favored by different treatment centers. Essentially, where a child is treated might significantly change the protocol they follow. There isn't a single universally accepted gold standard pathway yet.
And that's exactly why the final point of the paper is so critical for the future of the field. Could you dive into what international groups are doing to bridge that gap?
Because of those variations, international research groups are now working to establish a minimum standard of patient outcome data. The goal is to facilitate more effective future research. If we can all agree on how to measure success and what data points to collect, we can finally compare these different management pathways with some statistical rigor.
It's about moving from institutional preference to evidence-based standardization. For our residents and students listening, remember that BPBI management isn't just about the technical skill of the microsurgery. It's about the timing, the regular monitoring, and the multidisciplinary coordination between neurosurgery and orthopedics.
Definitely. It's a long-term commitment to the patient.
Well, that's a concise look at the 2026 update on brachial plexus birth injury. Thank you for joining me, Dr. Ilara.
Thank you, Dr. Alara. We'll see you all in the next episode.